Hello, welcome to my presentation. My name is Hadia, and I will be talking about chronic kidney disease. And this is my brother. He is within the ages of 8 through 11, so he will be here today with us.
Hi.
So, child, 8 through 11 years old. Let's explain kidney disease to a child.
Okay.
What is a kidney? So, kidney is an organ in your body. So, stand up.
Okay.
So, it's right here.
Right here.
It's right here.
So under my ribs?
Yes, a little bit under your ribs. And it kind of looks like this kidney bean. Do you see this kidney bean?
Yeah.
It's called a kidney bean because it looks like what?
Kidney.
Yeah, good job.
That's
a kidney. Kidney is important for your body because it filters your blood. So do you know whenever mama makes rice and we put it's in water and you want to take the water out to keep the rice in?
Yeah.
That's what your kidney does. So it takes the bad stuff out of the blood
the pee.
and it keeps the good stuff in. Oh, yeah, the pee basically, yes. All right, so what does it do? Yes, it filters blood. So I drew this photo by myself. I hope you like it. So this is called the renal artery, and this is the renal vein. So what does it look like the blood is doing in this one? Where does it look like it's going?
Into the kidney.
And where does the renal vein blood look like it's going?
Out.
Yeah, good job. So the artery takes blood in, the vein takes blood out. So the blood that goes in, it has to get filtered. Once it gets filtered, it's all good, beautiful, and the kidney's like, okay, you can go back to the body. This stuff, this yellow stuff, what does that look like?
Pee.
Yeah, so that's all the waste that comes out of your blood. So it filters blood, keeps the good stuff, takes out the bad stuff, which is the pee.
Yeah.
How does it work? So the kidney is this really big, like kind of...
It's not really that big.
Well, it's not really that way, but it's like, it has a lot of big things to do. So it's kind of like a factory, right? The little workers in the factory are called nephrons. So if you look right here, that's one of the little workers. But this entire kidney has so many of these. So this is just one. And it's only showing one right now, but it covers the entire thing. Like they go everywhere, right? So imagine a whole bunch of those, right? And so these nephrons, basically, they take a little bit of the blood that comes in from the artery, and they filter that out and take it to this thingy, which is called the ureter, which is where the final waste, aka the urine, goes, right? Okay, so what's next? What does a nephron look like? This is what it looks like. You don't need to really remember like everything about it, but one thing I want you to look at is, so look at all these little thingies around it, these swirly thingies. You know what that is? Yeah, those are veins and arteries. And so what'll happen is the blood will come here, all the bunch of stuff like salts and stuff will come out, and the salt and stuff will start going in here. So the blood doesn't actually go in the nephron, the like waste does, right?
Yeah.
Some of the waste, I don't know why the kidney does this, it takes some of the things you need and puts it in the waste pile. So you know what needs to happen?
What?
It needs to go back into the blood because it doesn't need to be going in the waste pile. So that's what happens. So the waste stuff goes over here, but the kidney over here is like, oh my God, I actually need sodium. So it takes sodium out and sodium goes into the blood, right? So then it goes up here, and the kidney's like, oh my God, wait, I actually need this potassium. So it takes the potassium out and puts it back in the blood. So at the very end of it, right here, this is where everything is just urine. Like it's all waste. You don't need any of it. By this point, all the good stuff is like back into the blood and all the bad stuff is going here. And this tube goes where?
To your bladder.
Yeah, good job. It goes to this thing called the ureter, which we saw in the last photo.
Also known as bladder.
Yeah, and then that goes to the bladder.
Okay.
Nice. So chronic kidney disease. So what do you think happens in chronic kidney disease?
It's the kidney stops working.
Yeah, so what does that mean?
So that means that it can't filter any bad stuff out of the blood.
So the bad stuff goes back into the body, and it's bad stuff for a reason. It's not good for you, right? So over here, we saw this little part, so the glomerulus, right? And this is where most of the blood gets filtered. So this is actual blood. Everything here is just filter, right? So the glomerulus won't be able to filter as good, meaning that stuff stays in the blood that's not supposed to be in the blood, right? So if the kidney stops working, what does that mean?
That means that it won't filter the blood.
Yeah.
And,
so your pee will be out of whack.
Yeah. And the bad stuff will be in your blood.
Yes, perfect.
And you have to go see a doctor.
Yes, you do have to go see a doctor. Correct. So what people can get chronic kidney disease more easily? So people with immune system diseases, so that could just mean like their immune system doesn't work as good as it does. People with diabetes, do you know what diabetes is?
Yeah.
Okay, well I'm just gonna tell you anyways. When your sugar isn't as absorbed by your cells as it should be.
Okay.
And then high blood pressure, the pressure in your blood is high. And then some genetic things. So sometimes people have a family history of it, meaning like their mom or grandma had it, and that means that they're more likely to get it.
Okay.
And then, okay, let's move this picture. So what are symptoms? What happens? So when there's extra fluid in your body and there's extra stuff, it can cause swelling. So that stuff can build up in like places, and then some parts of your body can swell, such as like your organs, or like sometimes it happens to your lungs too, where your lungs start swelling. So not good. Bones get weak. Not a good thing. Weak bones, not fun. How can you play soccer with weak bones, son? So don't get chronic kidney disease. Anemia, do you know what anemia is?
No.
So anemia is basically whenever your body makes less red blood cells, or less red blood cells are working. Okay. So a big thing with anemia is if you stand up and you get super dizzy. So stand up right now. Did you get dizzy? You don't have anemia. Good job. If the kidney totally stops working, then that means your blood can't be filtered. So that would mean you either get a new kidney or you get a dialysis.
How do you get a new kidney?
Sometimes there are ways to do that. There are things called transplants. So sometimes like there are people out there who die whose kidneys still work, and they say, if I die, let me use my kidneys and help someone else.
Okay.
So that's another thing. And then a dialysis is basically they put a tube in your body, and the tube takes out blood. It's like a electronic kidney.
Yeah, electronic. Yeah.
But it hurts a lot because you have to take all the blood out of your body and make it clean and then put it all back in. So that should not feel good.
Yeah, but getting a new kidney also
probably doesn't feel good. Yeah, you're right.
In the future, if people get kidney disease, they'll just probably have to take a pill and also.
I mean, maybe in the future, yeah.
Yeah. Maybe.
Okay, so for right now, though, this is how you not get kidney disease. So don't smoke. Son, do you smoke?
No.
Good, then you won't get chronic kidney disease. Using medication correctly. So if you are having kidney problems, it's good that you use what your doctor gives you correctly. And if like maybe you take an Advil or an allergy pill and the bottle says only take 1 pill a day, only taking 1 pill a day is a good way to not get chronic kidney disease. If you take 10, you will not. That would not be good. That would not be good. Don't do that, Hassan. Exercising, that's good. Exercising is good. You like to exercise, yeah. When you're not playing your PS4.
Yeah.
Eating healthy, yes, good, fun. Drinking lots of water and controlling diabetes if you have it. Nice. I think this is the last slide. All right, so today, again, we're going to go over the next part of the presentation, which will be teaching about chronic kidney disease to a teenager. So this is my teenage sister, and we're going to be teaching her. Let's get started. What is a kidney and how does it work? So a kidney is an organ that's kind of near your ribs, that's connected to your bladder through the urethra right here. And the kidney, imagine like a factory, and inside this factory there are a bunch of little workers that are called nephrons that all work together to purify your blood. So a nephron looks like this right here. And basically, there are a bunch of parts of the nephron, but the one that's most important is called the glomerulus, and that is where blood is actively filtered. We'll be learning about that in a little bit. And then another thing to note, that the blood goes into the kidney with the renal arteriole and leaves the kidney with the renal vein. Okay, so glomerular filtration, like I said before, it's where blood is actively filtered, and this has a big part in defining chronic kidney disease, specifically the filtration rate in the glomerulus. And the filtration rate is filtration pressure times the permeability. So that's going to be really important because it tells you like how much the kidney filters in that one nephron throughout a certain amount of time. And then another important thing to note is vasodilation versus vasoconstriction. So that'll happen in the renal arteriole and renal vein. And vasodilation is whenever the vein or artery is increased in dilate, so that more stuff can go through. And then constriction is whenever it is basically like tightens up and gets thicker, and there's like less space for stuff to go through. Okay. So there are normal fluctuations in blood pressure and osmotic pressure, and these are totally normal, not having anything to do with kidney disease. So this is just like if you drink a lot of water, there's more fluid in your blood, so there's more of your blood is going to be, there's basically just going to be a bigger volume of stuff going into the glomerulus, so the filtration rate increases. If your sympathetic nervous system is activated, which is fight or flight, your body isn't really going to be thinking about filtering stuff. It's going to be thinking more about pumping that blood throughout your muscles and stuff so you can run or whatever. And then parasympathetic nervous system, if that instinct is activated, then your filtration rate is increased because now your body has time to rest and be like, okay, now I'm going to filter these out and like take some of my time. So yeah, those are just like normal things. But chronic kidney disease is when things are abnormal. So it's a condition where the kidney starts to lose function over a period of time. And the way that people categorize chronic kidney disease is in 5 stages. The first stage is when the glomerular filtration rate, which is normally at over 120 milliliters per minute. Stage 1 is when it's less than 120 but greater than 90. Stage 2 is when it's less than 90 but greater than 60. Stage 3 is when it's less than 60 but greater than 30. Stage 4 is when it's less than 30 but greater than 15. And then stage 5 is when it's less than 15. And when your glomerular filtration rate is less than 10, that means that you need to get a dialysis, which is basically when it's like an electronic kidney, I guess is the way you could describe it. It's like a tube that takes up the blood from your body, purifies and like takes all the waste out, and then puts that good blood back into your body. So not the most exciting thing to happen to you, very painful. So something you should think about if chronic kidney disease is something that could be a factor for you in the future is you might not want to have it because of some of the side effects. The two leading causes for it in the US are diabetes and high blood pressure, and there are some reasons for this, particularly high blood pressure, that we'll go through in the next couple of slides. So causes and side effects of kidney disease, like I said before, high blood pressure and diabetes, and then you have glomerular nephritis, which is basically inflammation of the glomerulus, and then you have prolonged obstruction of the urinary tract. And so in terms of high blood pressure, one of the reasons for this is when the blood pressure in your body is high, the filtration rate increases. And if you think about it, like throughout the entire body, blood pressure would actually increase whenever the like capillaries and tubes are decreased because there's more stuff trying to go through a smaller space. So that's like one of the causes, like high blood pressure is because it decreases filtration rate due to like kind of that constriction of like more of the capillaries in the body, if that makes sense. Okay. And so some of the side effects would be like nausea, and then like I said, high blood pressure because of constriction, chest pain, and then swelling of feet and ankles. So since your body is infiltrating as it should be, there's more fluid and more waste in your blood that shouldn't be there, and that can kind of build up, which if it builds up in the lungs, it can cause chest pain, and then if it builds up in your feet or ankles, it can cause swelling of those areas as well. How to prevent kidney disease: to take your medications the way your doctor told you to. If you have diabetes, control it because that's a really big risk factor. Exercising and eating healthy is a kind of self-explanatory thing, like that's something you should regularly be doing. Getting tested regularly if your diabetes or high blood pressure are concerns, and then blood glucose test. That's important because if you have more glucose that's coming out in like in your urine, that could be something that is indicative of the fact that you have indicative of the fact that you have chronic kidney disease. And that is the end of this part. So this last part of this presentation is going to be the peer part of the presentation. So a kidney is an organ in your body that purifies blood, and it does this in 4 ways. It excretes out waste, it reabsorbs back in minerals, it filters the blood, and it secretes toxins into the waste. The kidney has nephrons that are all throughout the entire kidney, and they use osmotic gradients, which we'll see about in a little bit, in order to do all the 4 things mentioned. So the parts of the nephron, the one that's the most important is this glomerulus right here. This is where a lot of kidney problems occur, and so it's going to be really important for this presentation. And then one thing I just want to show is that there are certain osmotic gradients. So in this second diagram over here, where my cursor is at, the inner medulla is a super salty region, whereas the outer cortex are not as salty. So when ions and filters, when the filtrate is going down the loop of Henle, some of the ions will be able to go in / come out because of how the osmotic gradients are over here, where that one is super salty. So glomerular filtration. The glomerular filtration rate is characterized by filtration pressure times glomerular permeability, and the filtration rate is basically how much blood can be filtered in a certain amount of time. So that's really important because this chronic kidney disease is characterized in its stages by the glomerular filtration rate of the glomerulus at any time. So that's how they characterize what stage you are in kidney disease. So what is kidney disease and what are its stages? Kidney disease is a condition where the kidney doesn't work properly many times because of glomerular damage. And in the US, the 2 highest leading causes for it are diabetes and high blood pressure. So stage 1 is when your glomerular filtration rate is, and before we go over the stages, the normal filtration rate for a human is over 120 milliliters per minute. So that means 120 milliliters of blood are filtered per minute. So stage 1 is when it's less than 120 but more than 90 milliliters per minute. Stage 2 is when your filtration rate is less than 90 but greater than 60. Stage 3 is when it's less than 60 but greater than 30. Stage 4 is when it's less than 30 but greater than 15. And stage 5 is when it's less than 15. So whenever your glomerular filtration rate is less than 10, that means that the patient has to go through dialysis, which is basically purifying of the blood. And at that, around stage 5, the kidney is very prone to completely failing and like being gone. So the patient will need a new kidney, so a kidney transplant or a dialysis. So what are some things that happen with kidney disease? So we have decreased bone mineral metabolism, anemia, fluid and mineral imbalance, and increased blood pressure. So decreased bone mineral metabolism. So basically, vitamin D gets activated in the kidney to go and absorb calcium in the gut. However, if the kidney isn't working correctly, that means they won't be able to do this, meaning that calcium in the gut won't be absorbed and go to where it needs to go. So in doing this, parathyroid gland notices this decrease in calcium and increases its secretion of the hormones that it has. And the body takes this as a signal to use the calcium from the bones instead of the gut, and in turn weakens bones. So decreased bone mineral metabolism to that. So anemia, so kidney produces a hormone called EPO, and that signals increased red blood cell production. However, if there's a damaged kidney and production of EPO hormone isn't made, that means not as many red blood cells are made as normally. And so that would be a cause for anemia, and why anemia is one of the side effects of kidney disease. And so blood pressure. So having high blood pressure leads to hardening or weakening of the renal artery, meaning less blood goes to the kidney. So the filtration rate is already low, and all that filtrate stuff that needs to be taken out is still in the blood. So kidneys weaken and can't function as normally. And then also another part with blood pressure is that kidneys release a blood pressure regulating hormone, aldosterone. This increases blood pressure and when necessary, but more like different types of kidney damage can cause it to oversecrete aldosterone, which increases the blood pressure. And then we have fluid and mineral imbalance. So this is kind of self-explanatory in that the kidney does maintain fluid and minerals, but one thing we're going to talk about is bicarbs. So if bicarbs are regulated by the kidney, and if the kidney starts to lose its function, the bicarbs won't be able to maintain the neutrality of the body, meaning the body gets more acidic than it needs to be, and that is not good for anyone. So treatment of these kidney diseases, about the things that I talked about earlier. So an angiotensin converting enzyme inhibitor. So angiotensin is part of the cascade of things that causes aldosterone to go and like increase the blood pressure. So having an inhibitor in those cases would be able to be a treatment for kidney disease in an earlier stage. Giving like a manual form of an oral form of sodium bicarbonate, just like a way to put it in the body, would be able to maintain kind of that pH level. Giving manual EPO administration, so just putting that hormone in the way people put in insulin in their bodies. And then vitamin D supplements are also all ways to treat kidney disease. Preventions would be things like eating healthy, maintaining diabetes and controlling it, maintaining controlling blood pressure, not smoking, exercising, and drinking an optimum amount of water.